is about the therapeutic uses and adverse effects of fluoroquinolones. The therapeutic uses are based on the pharmacokinetic and pharmacodynamic properties of fluoroquinolones and the antibacterial spectrum of these antibiotics. Now let's begin with the mechanism of action of fluoroquinolones. The fluoroquinolones exert bactericidal action, which means killing of the bacteria. They inhibit bacterial enzymes that are crucial for DNA replication and multiplication. In gram-negative bacteria, the DNA gyrase enzyme is inhibited. The DNA gyrase enzyme is responsible for unwinding of DNA helix and helps in replication. While in gram-positive bacteria, the topoisomerase 4 enzyme is inhibited. The topoisomerase 4 enzyme works by cutting and rejoining of the DNA strands and helps in replication. So, inhibition of DNA gyrase enzyme in gram-negative bacteria and inhibition of topoisomerase 4 enzyme in gram-positive bacteria leads to DNA cleavage or breakdown of the DNA strands. So, there is failure of repair of DNA strands, and this causes disruption of DNA replication, multiplication, resulting in cell death. So next we move on to the antibacterial spectrum of fluoroquinolones. The fluoroquinolones are divided into 4 generations. The first generation includes nalidixic acid, which is a quinolone derivative, but it is not a fluoroquinolone. It is primarily active against gram-negative bacteria with minimal activity against gram-positive bacteria. The second generation includes drugs or antibiotics such as ciprofloxacin, norfloxacin and ofloxacin. This generation of fluoroquinolone has high activity against gram-negative bacteria, including Pseudomonas. It has limited activity against gram-positive bacteria and no action on Streptococcus pneumoniae. And therefore, this generation of cephalosporin is not preferred for the treatment of respiratory tract infections. The third generation of fluoroquinolone includes levofloxacin. So here the gram-negative activity of second generation is maintained. There is no reduction in gram-negative activity. However, there is enhanced or there is an additional gram-positive coverage. So additional gram-positive coverage in third generation fluoroquinolone with activity against Streptococcus pneumoniae. Also, it is used as a second-line drug for the treatment of Mycobacterium tuberculosis infection. The fourth generation of fluoroquinolone includes moxifloxacin. Here, the gram-negative activity is maintained. There is enhanced gram-positive coverage, and also they are highly effective against atypical pathogens such as Mycoplasma, Chlamydia, Legionella. Also, it can be used as a second-line drug for the treatment of Mycobacterium tuberculosis infection. Also, in MAC infections or Mycobacterium avium intracellularly complex infections in AIDS patients. Now, to be noted that moxifloxacin is the only fluoroquinolone that possesses activity against anaerobic organisms. So, anaerobic organisms are affected by moxifloxacin, and the fluoroquinolone which has strongest activity against Pseudomonas organism is ciprofloxacin. What are the key pharmacokinetic features of fluoroquinolones that determine action of these antibiotics? The fluoroquinolones have excellent tissue penetration. They attain high concentration in the lungs, prostate gland, soft tissues, bone, joint cavities, and therefore they are useful for treating GI infections, genitourinary infections, prostatitis, soft tissue infections. With respect to excretion of fluoroquinolones, the second generation fluoroquinolones, particularly ciprofloxacin, norfloxacin, ofloxacin and levofloxacin, are renally eliminated. They are eliminated through the kidney. They attain high concentration in urine, and therefore they are preferred for the treatment of urinary tract infection. The higher generations of fluoroquinolones such as moxifloxacin are hepatically eliminated. They are not dependent on kidney for elimination and are preferred for respiratory tract infections, and since they are dependent on liver for metabolism and excretion, so dose adjustment in renal failure is not needed with moxifloxacin. The next pharmacokinetic feature of fluoroquinolone is that they have high post-antibiotic effect, which refers to persistent suppression of bacterial growth even after the drug concentration falls below the minimum inhibitory concentration. This occurs particularly in gram-negative bacteria due to persistent inhibitory action on DNA gyrase enzyme. This leads to damage to the bacterial DNA and results in delayed regrowth of bacteria. So this leads to prolonged suppression of bacteria, and this enhances bacterial eradication, minimizes the risk of development of resistance, and also reduces the need for frequent dosing because of prolongation of the duration of action. So fluoroquinolones, although they have a short T-half, the duration of action is long because of the post-antibiotic effect, and this reduces the need for frequent dosing. Now let's discuss the therapeutic uses of ciprofloxacin, norfloxacin and ofloxacin. These antibiotics, particularly ciprofloxacin, attains or accumulates in high concentration in the kidney and prostate gland. It is preferred for the treatment of urinary tract infection, complicated pyelonephritis, and inflammation of the prostate gland, that is prostatitis. Secondly, these fluoroquinolones, particularly ofloxacin, is preferred for the treatment of gastrointestinal infections such as bacterial dysentery. The third use is typhoid fever, which is caused by Salmonella typhi, which is a gram-negative organism. And since fluoroquinolones have high activity against gram-negative organisms, they are preferred for the management of typhoid fever. And since ciprofloxacin is eliminated in feces and bile, there is high concentration in feces and bile, it is preferred for the treatment of typhoid fever and also prevents carrier state. The next therapeutic use of fluoroquinolone is soft tissue infection and wound infection. Now, since ciprofloxacin has high gram-negative activity and also it accumulates in high concentration in the tissues, it is very useful for treating soft tissue infections, particularly ciprofloxacin, which has high activity against gram-negative organisms, including Pseudomonas. Now, since anaerobic organisms also play a role in these infections, ciprofloxacin is often combined with metronidazole or clindamycin that have anaerobic activity. So, ciprofloxacin also treats diabetic foot. Now, malignant otitis externa is a serious external ear infection where Pseudomonas is the causative organism. This occurs particularly in diabetic patients and immunocompromised patients. So, ciprofloxacin having high activity against gram-negative organisms, including Pseudomonas, is used for the treatment of malignant otitis externa. Bone and joint infections such as osteomyelitis and septic arthritis can be treated by ciprofloxacin. So, gram-negative infections in the bone and joints are treated with ciprofloxacin and other fluoroquinolones. Now, speaking about sexually transmitted diseases, chancroid, which is caused by Haemophilus ducreyi, a gram-negative organism, can be treated by ciprofloxacin, which produces 98% cure. Gonorrhea, that is gonococcal urethritis, cervicitis, can be treated with ciprofloxacin. Also, urogenital chlamydial infections. So, chlamydial infections can be treated with ciprofloxacin. Now, notable use of ciprofloxacin is anthrax. It is the first line drug that is used for post-exposure prophylaxis and treatment of inhalational anthrax. So, inhalational anthrax, which is caused by Bacillus anthracis, can be treated with ciprofloxacin. Now, when it comes to respiratory tract infections, although it is not a preferred drug in respiratory tract infections, but certain infections such as cystic fibrosis or hospital-acquired infections where Pseudomonas is the causative organism, ciprofloxacin can be used for treating cystic fibrosis or hospital-acquired pneumonia. Let's now discuss the therapeutic uses of higher generations of fluoroquinolones, particularly moxifloxacin and levofloxacin. Since these antibiotics have high activity against gram-positive organisms, gram-negative organisms, They are very useful and preferred for the treatment of respiratory tract infections such as community acquired pneumonia, chronic bronchitis, and acute sinusitis. They are also effective against Mycobacterium tuberculosis infection and is a second line drug for the treatment of Mycobacterium tuberculosis infection. Since it has action against anaerobic organisms, they are useful for treating soft tissue infections where anaerobic organisms play a predominant role. They are also available as ophthalmic preparations and are useful for treating ophthalmic infections such as conjunctivitis, corneal ulcer because of their good penetration capability, accumulation in the tissues, and also enhance gram-negative activity, gram-positive activity, and anaerobic activity. They are also used for treating MAC infections in AIDS patients and in immunocompromised individuals. Lastly, let's discuss the adverse effects of this class of antibiotics. So, gastrointestinal symptoms such as nausea, vomiting, abdominal discomfort, diarrhea are common side effects of these antibiotics. Serious side effects such as headache, dizziness, insomnia, and rarely hallucinations or delirium may occur. Severe side effects such as QT prolongation is observed with fluoroquinolones such as moxifloxacin and gatifloxacin. So they can cause QT prolongation and this can precipitate or increase the risk of serious cardiac arrhythmias. Also, there is a risk of arthropathy and therefore they are contraindicated in children less than 18 years. They are also contraindicated in pregnant women because they can cause cartilage erosion in joint pairing areas. So they can cause arthropathy and also tendonitis or tendon rupture can also occur with fluoroquinolones. So tendonitis and tendon rupture, the most common tendon that is affected is Achilles tendon and this has been reported with many of the fluoroquinolones. Allergic reactions and rash can also occur with fluoroquinolones. Photosensitivity is a class effect of fluoroquinolones and episodes of hypoglycemia and hyperglycemia have been noted with gatifloxacin. Therefore, it has been withdrawn from the market. In this lecture, we have covered the mechanism of action, key pharmacokinetic features, the therapeutic uses and adverse effects of fluoroquinolones. So thank you for watching. If you find my video useful, please like, subscribe and share.